Namaste. I'm Dr. Anushree Muralidharan and today I'm here with a topic tonsillitis. We, Divine Veda, as a team, are on a mission to create awareness about Ayurveda, yoga, diet, and lifestyle through YouTube and other social media platforms like Instagram and Facebook. We take this opportunity to thank you for the immense love and support you have given Divine Veda in our journey. As a token of gratitude from our side, we have started a giveaway of rupees 500 to one active subscriber every week from our subscribers list. For being the active subscriber, you just have to watch the videos and comment your opinions and suggestions in the comment box below. Last week's winner is Shrikant Kulkarni. Congratulations, Mr. Shrikant. This week also we have selected one active subscriber. The name of that lucky person will be announced at the end of this video. So please do watch this video till the end to know who the lucky person is. And try to share this video with your relatives and friends. So try to grab this opportunity by watching the videos. Tonsillitis is most common among children and is a headache for parents due to its frequent attack, because of which the child will find it difficult to go to school and miss their classes. It is quite a painful condition, and if it is left untreated, it may lead to various complications. It may also occur in adults. If it is taken care from beginning, the serious complications and surgery can be prevented. If you are a person who gets tonsillitis very frequently, there are some precautions that you need to take to prevent its recurrent attack. In this video, I will be discussing about tonsillitis, tonsils, location of tonsils, function of tonsils, classification of tonsillitis, signs and symptoms, complications, diagnosis. So please do watch this video till the end to know what tonsillitis exactly is. Let's start the video. Tonsillitis. Tonsillitis is the inflammation of tonsils, which are cluster of lymphatic tissues in pharynx on either side of throat. First, let us see what tonsils are. Tonsils are a pair of oval-shaped lumps of tissues at the back of the throat located on either sides. There are three sets of tonsils in our body. Pharyngeal tonsils, which are also called as adenoids, palatine tonsils, and lingual tonsils. But palatine tonsils are referred to as tonsils usually when we speak. Tonsils will be larger in children, and as they grow up, it gradually gets smaller or the size reduces. Now let us see the functions of tonsils. Tonsils were called vestigial organs, which is of no use and considered as an obsolete part, so doctors advocated tonsillectomy or removal of tonsils when it get infected. But now it is not considered as useless anymore. They act as first-line defense of our immune system. Tonsils also plays a very important role in maintaining our immunity by fighting against foreign bodies like germs and microbes by producing antibodies. Now let us see the classification of tonsillitis or three types of tonsillitis. Tonsillitis is of three types: acute, chronic, and recurrent. In acute tonsillitis, symptoms last for 3 to 4 days, but sometimes it may last for 1 to 2 weeks also. In chronic tonsillitis, symptoms last for a long term, maybe for more than a month or so. When symptoms appear several times in a year, it is called recurrent tonsillitis. Have you ever thought how tonsillitis is caused? Tonsillitis is commonly caused due to infection by a bacteria or a virus. Usually it is caused due to Streptococcus pyogenes bacteria, but other strains of Streptococcus and other bacteria may also cause tonsillitis. It may be caused due to virus also, like adenovirus, influenza virus, Epstein-Barr virus, etc. Tonsillitis is usually associated with common cold and sore throat. How can you identify that you are suffering from tonsillitis? Yes, through signs and symptoms. Tonsils will get inflamed and swollen and appears red in color. The surrounding area will also appear reddish. Whitish clotting or patches are seen on tonsils. The patient will experience sore throat and difficulty to swallow. Hoarseness of voice or a muffled voice is usually noticed. The patient will also suffer from fever and chills, headache and fatigue, etc. Ear pain, bad breath, and difficulty for chewing is also noticed in a few. Some patients rarely experience stomachache as well. This is commonly seen in children. How to recognize that children are suffering from tonsillitis? Children will be having all these above symptoms. So, the children should be asked to open their mouth, and with the help of a torchlight, the inner part of mouth and throat should be visualized. If these above symptoms are noticed, then immediately medical care should be given. Some children will have drooling from their mouth, and some refuse to take food due to the difficulty to swallow and pain in throat. Once tonsillitis is diagnosed, it should be immediately treated. Otherwise, it may lead to complications. Let's see what the complications are. Obstructive sleep apnea. It is the difficulty to breathe, especially during sleep. Peritonsillar abscess. Formation of abscess with pus inside behind the tonsils, which cause extreme pain. When the bacterial infections start extending into surrounding cells and tissues of tonsils, it is called tonsillar cellulitis. Scarlet fever is a kind of fever which follows a sore throat or impetigo caused by Streptococcus bacteria. When bacteria gets into bloodstream, it produces toxins which lead to toxic shock syndrome, which is a rare complication. Necrotizing fasciitis, also known as flesh-eating disease. It is a rare condition where the superficial fascia is infected by bacteria that multiply and release toxins which result in clotting or thrombosis of blood vessels. So there won't be enough blood supply, due to which necrosis starts in subcutaneous tissue. Some other rare complications are glomerulonephritis, middle ear infection, rheumatic fever, and sinusitis. Now let's move on to the very important part of this video, diagnosis of tonsillitis. As the primary step of diagnosis, the doctor should first ask the history of the patient along with signs and symptoms. Then he should go for a physical examination. Physical examination include checking whether tonsils are reddish, swollen, and have pus inside, with a torchlight for visualizing the inside of the throat. They should also check whether whitish patches are present on the swollen tonsils. Nose and ears are also to be examined to check whether any infections are present or not. Either sides of neck are to be examined to check whether any external swelling is present or not. After the physical examination, if anything suspicious is found, a doctor will go for throat swab. Throat swab will be collected from the back of the throat, and culture is done to check whether it is due to any bacteria or virus and to find the strain of the bacteria. Complete blood count is also checked to look for the number of blood cells, whether it is high or low. Rapid strep test is a test to rule out the suspicion of Streptococcus bacteria, which is one causative factor for tonsillitis. By now, you may have clearly understood the basics of tonsillitis. I hope this video is informative. I have done a separate video in which I have discussed about usually given treatment, tonsillectomy and its adverse effects, Ayurvedic perspective of tonsillitis, Ayurvedic treatment protocol, herbs effective in tonsillitis, precautions to prevent tonsillitis, and home remedies. Link of that video is given in the subscription box below. Please do like this video and comment your opinion in the comment box below. You may also comment the health issue or disease which you want me to discuss. I will try to come up with videos for the same. Also, please do subscribe if you haven't done it yet. Now, it's time to announce the active subscriber of this week. The active subscriber of this week is Chidambar K. Congratulations, Mr. Chidambar. The winner should immediately contact us in our email ID, contact@divineveda.com. Continue watching the videos from Divine Veda and keep supporting us. Thank you for listening. This is Dr. Anushree signing out.